Hey guys, how you doing? Dr. Nathan Thompson here with Exemplify Health Center, a Wellness Way affiliate right here in Yorkville, Illinois. Apologize for the delay. We have a couple of technical difficulties when it comes to the sound, but we're back up again. So hey guys, today is your Tuesday question and answer. So we had some people submit some really awesome questions that I'm going to talk about on this live video. So I'm going to talk about why people have a cough when they're on blood pressure medication, a dry cough, what you need to do about it. I'm also going to talk about the gallbladder. Do I ever recommend that you get it removed? Also talking about antibody tests. What's the deal with all of these antibody tests? And you know what I'm talking about because I can't say it. What's the deal with this antibody test, and does it mean lifelong immunity? And I'm also going to talk about nail health. Someone asked a really awesome question. My nails are yellow and cracked. What does that mean? So I'm going to talk about all of those different things. So if you are watching right now, go ahead and say hello. Let us know where you are watching from, and if you're watching the replay. If you're watching the replay, go ahead and type in replay so that I know you guys are coming back and watching this. All right. Now, at any time, if you find this, what I'm going over, you find this beneficial and you know someone that can benefit from it, please share this because what we're going to go over is some really awesome things that I know are going to be able to not only help people, but really could potentially save their lives. So, Amanda, thank you for joining us. Hopefully you can hear me okay, as I realized I was 5 minutes into the last one and my mic was not on. So technology, you love it. I love it when it works 60% of the time. All right. Now, before we get into any of the questions, I want to go over something really important. Okay. So we always want to give things of value to you. And here's the next thing that is going to be really valuable for you. So coming up May 1st, is No Sugar May. And this is within the Wellness Way Challenge group. So within the Wellness Way, we have an awesome group. If you're not a part of it, make sure that you search this within your Facebook's toolbar. You will actually see within that, if you type in the Wellness Way Challenge group, you will be able to join that. There is well over 5,000 people within that group. January was no sugar. February was reducing stress. March, which I led, was fitness, and then April was kindness, and then May is going to be no sugar again. So guys, we have tons of resources for you, but it's all about not avoiding all sugars, not about going keto. It's about reducing some of the most damaging sugars within the body. Now, just full disclosure, the body does need sugar. It just depends on the kinds of sugars. But if you look at the standard American diet is composed of too many sugars for your body to be able to function well. And it's also too many rapidly absorbable sugars. And so we are going to go over how you start eliminating that from your diet. There is foods that you will be able to have, foods that you can't have, and also some great recipes and things like that. Now, if you guys did No Sugar January, give me a thumbs up. So if you're watching this right now and you did No Sugar January, give me a thumbs up. I know there's a lot of people that did it. And typically those people fell into two different categories. There was the first one that did absolutely fantastic. Their life was changed. I mean, radically changed, massive health changes, weight loss, things like that, even though it's not a weight loss challenge. And then there's another group of people where they're saying, please help, nothing's happening. I have no energy. What's going on? I'm actually gaining weight. What is the deal with this? It must be something wrong about No Sugar January. And there isn't, okay? It's just the fact that when you start to do the right things, if the body starts responding specifically to that, it means that you have some issues that you need to start addressing. In fact, one of the cool things is within the Wellness Way, we actually made a blood panel that you can get through your Wellness Way doctor that will show whether you're going to have some issues going on No Sugar January. So there's a couple of lab markers that you really can look at to determine if No Sugar January, if it's right for you, or if there's a little bit of groundwork that you need to do before you start doing any of that. So guys, thanks for the thumbs up. You guys all did No Sugar January. I love it. Let's do No Sugar May, because guess what? I'm going to be doing it as well. You know, full disclosure with April, how many of you guys in April with this whole quarantine, the whole virus pandemic and stuff, it was really hard to focus on health, and even for me. So there's a minimum standard of engagement that I made sure that I did. But as far as focusing on some things, I just didn't, because a lot of my time was actually spent like reeling, trying to do 100 different things just to make sure that we are adapting appropriately to this situation. So May, things have calmed down. Things are going to be getting back to normal, not the new normal, back to normal. And so now is the time to start doing something in order to improve your health. Now, listen, you have the ability to improve your health. And let me tell you something, sheltering in place, staying inside your house, wearing a mask, wearing gloves, all of those things do nothing for your health. In fact, those things over time are the only thing they're going to do is they're going to make you weaker. So let's do something in order to strengthen your body. So again, guys, make sure that you search in your Facebook search bar up at the top, Wellness Way Challenge Group. If you're not a part of that, ask to join, and then you'll be ready to go for May 1st for No Sugar May. So guys, it's very easy functionally to do. Mindset wise, it gets a little bit tough, but I'm going to tell you, if that you can do that, you'll come out on the other side a whole heck of a lot better person, mentally, and also physically. All right. So let's get into some of the questions. Thanks again for submitting those questions. And if you have any at the end, I'll scroll through the comments and see if we have enough time to answer some of those other ones as well. Okay. So someone asked the question, and so it's a really good question, because this is probably something that you know someone who is taking a blood pressure medication, specifically what's known as an ACE inhibitor, angiotensin converting enzyme inhibitor. So this is an enzyme inhibitor within the lungs that helps to lower blood pressure by blocking enzyme activity, okay? So they asked the question, what does it mean if I am on this blood pressure medication and I develop a dry, hacking, non-productive cough? What does that mean, okay? Here's what it means. It means you need to go off the blood pressure medication. That's the short answer, is that you need to get off of the blood pressure medication. Now, here's what's happening. I've actually seen this clinically, is that we had a patient who was on an ACE inhibitor from the time that they were 21 years of age, and he recently, we were able to help him get off of it at 66 years of age. So he was on an ACE inhibitor for 45 years, if you can imagine that. And in addition to that, taking him through, based off of his testing, doing the right nutrition, actually going through detox in order to help his liver pathways and things like that. He's lost, I believe, over 50 or 55 pounds, which we don't really care about that, but that's just a side effect of getting the body's systems back up to speed and healthy again. But at the end, he said, you know, I've developed this really dry, hacking cough. It's non-productive, and it's just, I know that I don't have an infection. I have this cough all the time. And I said, well, listen, you're taking an ACE inhibitor. What that means is that can be actually a clinical indication that you need to get off of the medication. So he was taking his blood pressure in the morning, and his blood pressure in the morning was about 90/55. And he said, should I be concerned about that? And I said, hey, listen, that means that you need to be off of the blood pressure medication, because once you go off of the blood pressure medication, your blood pressure is going to go back to normal. So remember, there is nothing more physiologically manipulating than any kind of medication. So if you want to manipulate something, take a medication. Don't try to manipulate it with herbs or with supplements. Those are not as powerful at all. So we don't want to manipulate physiology. What we want to do is we want to restore it. We want to restore normal physiology. We don't want to manipulate abnormal physiology into another abnormal physiology just so that a number can look normal. So with that ACE inhibitor, if you start developing that dry, hacking cough, you need to go to your doctor and you need to talk about them, because chances are, if you still haven't addressed the reason why your blood pressure is high, they're going to have to switch you to a different medication that's not necessarily an ACE inhibitor. There's different things that they'll use in order to lower blood pressure, like calcium channel blockers or things like that. But when it comes to that ACE inhibitor, it can be a bad day when it comes to the lungs. And just remember, is that when you're affecting the lungs, it can make you a lot more susceptible when it comes to any kind of viral infection that enters through your airways and enters in through your lungs. So great questions. Blood pressure medications and having that dry cough. All right. Now, another question that came through was, should I get my gallbladder removed? All right. Now, best way they can answer this is by saying this. Everyone is different. Everyone is unique. But I'm going to say this. There is a reason why you have a gallbladder. A gallbladder is not a useless organ. Neither is your appendix. Your appendix is not a useless organ. And I come from the mindset that the body, every organ in the body there is a need for it. There's a reason for it. And if that you have that organ, you want to keep all of them. So what's the purpose of the gallbladder? Well, the gallbladder is actually a lot more sophisticated than just some kind of storage tank for bile. So if you look at what bile does, is bile is actually produced in the liver, and then it's actually kind of filtered or squirted into the gallbladder where that bile is actually stored. Now, the gallbladder is actually a sensory organ too, because it actually senses changes in digestion so that it can release that bile into your gastrointestinal system. And what it does is it helps to emulsify and starts to break down your fats. And so that way you have a storage tank that if you eat a higher fat meal, you can release a little bit more bile from your gallbladder. So the problem is when you get your gallbladder removed, you no longer have that storage, which means you are 100% dependent on how much your liver can secrete right at that moment, which means if you have a little bit more higher fatty meal, you're not going to have enough of that bile in order to break down and emulsify those fats, which means you end up not absorbing a lot of fat and it ends up in your stool. So what happens if you don't have very good fat absorption? You're going to be vitamin deficient, especially in vitamin D, because every single person who has had their gallbladder removed is so chronically vitamin D deficient. Remember this, vitamin D influences over 1,500 genetic functions. So vitamin D is absolutely critical for so many things: energy, pain levels, weight loss, muscle function, immune system, all of those different things, which is why so many people feel so horrible when they've gotten their gallbladder removed. So it comes back to the question, should I get the gallbladder removed? Well, listen, sometimes if there are so many stones that are in there that those stones are not going to be able to break up, sometimes people have to do an emergency gallbladder removal. Now, sometimes people can have smaller gallstones. If they have some smaller gallstones, there's some things that you can do in order to help break up those stones, and so that it can clear out the gallbladder a little bit. And so you'll break up the stones and then secrete it into your gastrointestinal system. So I've had people, we've done some things to break up the stones, and they've looked in their stool, and about 2 or 3 days later, and there's literally dozens and dozens and dozens of tiny little gallstones that are small enough to be able to pass through the common bile duct, and we're able to get past. Now, if you have bile sludge, bile stones, or gallbladder stones, or the gallbladder is sludgy, really what it means is there's a problem in the liver. So there's a problem, again, the liver makes bile. And so if you're having a problem with that and making stones, there's a problem with the metabolism or with the production of bile, which means that you have a problem with liver pathways. And this is why, if you've gotten your gallbladder out, let me tell you something. This is why you have so many other issues. This is why women have so many issues with things like fibromyalgia, for example, and having their gallbladder removed. Why they have a problem with estrogen metabolism and they've had their gallbladder removed. Because just if you remove the gallbladder, you still are left with the problem. And so it's really a problem with the liver. We got to stop blaming the gallbladder. And furthermore, just because you get your gallbladder out doesn't mean that all your problems go away. The problems are still there and they will come back. I remember we just had a new patient from yesterday. She's had her gallbladder out when she was 19 years of age. And if you just look at her history, when all of these problems started, I said, when did your problems start? Problems with chronic pain, connective tissue issues, fibromyalgia symptoms, low energy. She said, I just didn't start feeling very good when I got to be about 21 years of age. And then I started, stress and work and kids. She's like, it just all hit the fan. She says, now I'm 33 years of age. And the fact of working, being a mom, and the fact of even getting up to do any kind of movement or exercise is just the worst feeling in the world. She's like, I'm 33. How am I supposed to be 43 and have any kind of normal functional life? So a lot of those problems happen, not only getting her gallbladder removed, but also the physiology that caused her gallbladder not to function the way that it was supposed to. Okay. So should you get the gallbladder removed, if you can do anything to keep it, please keep it, because God put it there for a reason. Keep the organs that God gave you. Please do everything possible. So that's a great question. Here's another one that was submitted as well, is do antibodies equal lifelong immunity? All right. Now, if you've watched Dr. Patrick Flynn's Q&As, a different perspective from Dr. Patrick Flynn, and even just some of his random lives that he goes, he's been talking about all through April. He's been talking about the immune system. So I recommend that you go back and you watch all of those different perspectives from Dr. Patrick Flynn from his page, and watch all of those and how he talks about antibodies, and why just the fact that you have antibodies, it does not equal lifelong immunity, okay? Because once you have an exposure, the B lymphocytes will start to secrete some antibodies. But over time, those antibodies will wane because they're actually gobbled up and taken care of by T cells. So by that immune system, which is why some of the sickest people are the ones who have the highest antibody count within the blood. So, but the fact that I was exposed to something, does that mean that I have lifelong immunity? And no, it doesn't. And I'll give you a perfect example. So I was probably the last generation that actually had chickenpox. And in fact, they came up with the chickenpox vaccine probably about 5 or 6 years after I had gotten chickenpox at 4 years of age. Now, just remember this: chickenpox is a extremely benign virus. It will cause maybe some runny nose, it'll cause a virus or a fever for a little bit, and you'll break out in a rash. That's the body getting rid of the virus, or shedding the virus, getting rid of it. It's the body handling it. And in fact, in my day, we used to have chickenpox parties. Heck, 40 years ago, 50 years ago, they used to have measles parties, because they realized that these viral infections are not only they're not dangerous, but they actually have a benefit to the immune system. Okay. So just think, the more exposure that I have to more things, the more that my immune system, just like a muscle, gets to react, gets to grow, gets to adapt, gets to learn. And so it helps it to become stronger, and more mature. And as that happens, it will help you later on in life to actually identify foreign versus self. If you look at it, a lot of people are having a hard time being able to identify foreign versus self. And they have very immature immune system, which is why you see cancer, which you have, and you also have autoimmunity going through the roof over the last 25 to 30 years. So do antibodies equal lifelong immunity? Well, if you think about it, all you got to do is just go ahead and search this, because this has been kind of like, besides our pandemic right now, some of the stories underneath it, they talk about what the World Health Organization actually said. So the World Health Organization said, hey, you know what, guys? This pandemic is dangerous. And if you've been exposed to it, you do an antibody test and you have antibodies, it doesn't mean that you're necessarily immune to it. Now, are they right? Yeah, they kind of are, because antibodies do not equal immunity. Okay. So it will help you to have a faster reaction, but the whole idea of immunity through antibody exposure doesn't even make sense when you look at how the immune system functions and how the immune system is supposed to work when it comes to exposure, or when it comes to how to handle it first. Remember, you have two different parts of your immune system. You got the adaptive immune system, which involves antibodies, but you have the innate immune system, which is actually what you need to have a very strong response to, so that you don't have to rely on all these antibodies all the time. So the World Health Organization says, hey, if you have antibodies, it doesn't mean that you are immune to this virus. So they just admitted that it doesn't mean that you're going to have immunity to it, but watch. So I want you to pay attention to this and give me a thumbs up. Give me a thumbs up. You need to remember this, because once they come out with a vaccine in which how they determine the efficacy of a vaccine is by an antibody titer, the presence of antibodies, then they're going to say, hey, you know what? Now you're immune. Even though they just said if you get natural immunity and antibody production, you're not immune, but as long as you inject it and get antibodies, now you're going to be immune to it. And you are going to see how they are going to completely change their story once a vaccine actually comes out. So how crazy is that? Now, if you ever heard of boosters, now they remember said you got a measles vaccine back in May, you'll never have to get a measles vaccine again. Now they are actually saying, gosh, of course, if you put an antigen within your blood, you're going to have an antibody response. Of course, that's going to happen. But then over time, the antibodies within the blood begin going down. And that's why they say you actually need a booster. So if you get natural immunity, you get natural antibody production, it's always a good idea to try to continue to get exposure to certain things. Keep exposing your body. If your immune system is strong, now you have actually provided a boosted an antibody response. But you have to make sure first and foremost that it's all about having a very strong and robust innate immune system response. That comes from skin, mucous membranes, the barriers that are within the nose, the mouth, the gastrointestinal system with the skin. And if you can provide in the lungs, if you provide a strong response during that, that is going to be your best bet in overcoming any kind of bacterial or virus infection. Okay. So hopefully, guys, that makes sense. Give me a thumbs up if that makes sense. So, hey, guys, again, thank you for joining us. A couple more questions that we have coming up. Mila, how are you doing from Washington? Amanda, Roxanne, Amber, Nick, how are you? Thanks again for the gift. Amber, Carrie, how are you doing? I hope you're doing well, Carrie. And Sue, Matt, how are you doing? Hope you're enjoying your home workouts. Nancy, how are you doing? Jill, good to see you on here, Jill. I hope you're doing great. Jennifer, Robin, Diane, how are you doing, guys? I hope everybody is doing fantastic. All right. So, and Michelle as well. All right, so guys, here's the next one. You guys have probably have had this question in the past. Is this, help, I have yellow, my nails are turning yellow and they're cracking. So what on earth should I do for that? Okay. Now, just remember this. If you are having, so if you look at hair health, you look at nail health, you look at that, a lot of that has to do with absorption of nutrients, okay? So absorption of B vitamins, for example. A lot of times when people say, oh, my hair and nails is very good, I need biotin. So how many shampoos, for example, you'll see for strong hair, you need biotin. In reality, remember, health is an inside job. So putting biotin on your hair is not going to give you amazing health, but being able to consume and absorb biotin is way more important. So when you are talking about anything with the nails specifically, you have to think about, number one, absorption, but number two, if you have some kind of underlying infection and a low or suppressed immune system, okay? So, for example, if you got yellow nails, like yellow toenails, one of the things that this can mean that you have an issue with yeast, yeast overgrowth. And where this is going to overgrow is going to be within the gastrointestinal system, okay? So now think about this, is you have to think about how people get a yeast overgrowth within their lower intestine, within their small intestine. The first thing is they probably don't have their gastrointestinal system properly acidified. So they probably suffer with low stomach acid. Probably they might not need some gallbladder help. What happens is that's one of the first things. They're probably doing some things to knock down the natural microbiome within their gastrointestinal system as well. Their barriers have been suffering as well. So you have, yeast is actually normal flora. So it's just normal to reside within the gastrointestinal system. And so one of these things that can happen is the yeast can start to overgrow when the environment is right. Okay. So a lot of times people are saying, well, I need to take, do an anti-yeast protocol or whatever. And I say the first thing is just get back to the basics and actually just make sure that the digestive system is healthy and you're not doing anything to interfere with it. Are you taking antibiotics? Are you putting hand sanitizer all over your hands all the time? Are you consuming high amounts of wheat that are going to contain Roundup or glyphosate, corn, soybeans, things like that, all known to destroy the microbiome? Like, start doing some of the basics first. You don't have to take anything in order to do that. But if that environment isn't right for a healthy microbiome, you're going to see some things that are really neither good nor bad start to pop up. And one of them can be yeast. So if you have a yeast overgrowth, then what can happen is, which is considered a fungus, you can see some of these things start to pop up underneath the nails. Now, one of the ways in order to easily get some kind of fungal infection is to lose the nail bed, which will then expose it. And so then combine that with having some kind of lower intestine yeast overgrowth, and you'll see some of those things start to pop up. Now, the other thing too is that if you do a stool test on these people who have toenail fungus and things like that, you also will probably see a very low immune system response going on. So these people also are doing some things in order to decrease having a sufficient immune system response. So really what you have to do when it comes to that is you have to start at the top part of your gastrointestinal system, which is just making sure that the stomach, the pancreas, the liver, the gallbladder are all firing on all cylinders, and then make sure you're not doing anything in order to feed that yeast down through the lower part of the intestines. Now, there's some certain things that you can do in order to get rid of candida or yeast or anything like that. Absolutely. But just remember, if you do that, but you don't change some of the fundamental things, it's just going to come back. So it's always going to come back. So rather than just, try to work on putting things on the toenail to try to remove the fungus, you can do that maybe to give it a little bit of help. But if you don't fix some of the underlying causes, it's just going to come back. Now, one of the things, though, that you can do, if you do have some kind of nail fungal infection underneath the nail bed, is you can actually remove the nail, work on removing the nail, and then you can actually put silver, okay? So you can put colloidal silver on this. You can spray that on the nail bed, and that will actually cause the fungal infection to go down. Some people, what they have done, especially around the toe, is they've sprayed some silver on it, and then they've actually wrapped the toe up in the finger of a latex glove over the toe, and they've actually just let that silver just marinate so that it can give the body a little bit of help to lower some of that fungal infection that's going on. So hopefully that makes a little bit of sense for you. Do you recommend going on antifungals and things like that? I don't recommend doing it because that stuff is tough on you. That stuff is nasty. Start working on getting to the cause, obviously. So if you guys got any other questions, I see we have one question. We got a couple of minutes be able to do. So back in the day, we were vaccinated for polio. Now they typically not vaccinate for this. What happened to polio? Well, they still do actually vaccinate for polio. So diphtheria, pertussis, DPT, I can't remember even the name of it. What is it? DPT? Polio, diphtheria, tetanus. Okay. So they actually do, in fact, vaccinate for polio. Just remember this: polio is the route of infection for the polio virus is gastrointestinal. So one of the biggest ways that you can get polio is kind of gross fecal to oral. Okay. So being exposed to feces, and then it goes through the mouth. So guys, if you actually look at any historical data when it comes to all viral infections, you're going to see that they're all cyclical. So you're going to see that these things wax and wane, they come back and then they go away. People get natural immunity to it and they go away, they'll come back. But the thing, if you actually look up, and a great resource for you to actually watch this or to watch would be Dr. Sherry Tempany. And on YouTube, she has tons of resources when it comes to polio infection. Like literally when you look at the numbers, how many people actually had any kind of permanent residual paralysis from polio. And the numbers are really, really, really low. Okay. Now, you just got to remember this too, is that there's always going to be people who are negatively affected from any kind of infection. But rather than try to weaken try to weaken everyone's environment to suit a weakened person, we say, why don't we strengthen everybody to be able to withstand any environment? Okay. All right. So Michelle says you talked before about never using ice on an injury. Would that apply for a torn meniscus? All right. So here's the thing with the torn meniscus. These things can be a little bit tough. So when you look at a torn meniscus, here's where ice can help. Ice can help because if you numb the area, you're not going to be in a lot of pain. All right. But when it comes to a torn meniscus, it's a little bit different because meniscus, generally speaking, don't have a real great blood supply. So it depends on where you tear the meniscus. Let's say it's a medial meniscus on the inside of the knee, if generally you tear the outer third of it, the outer third has a blood supply to it. So if you tear it, it has the ability to be able to heal. So in that case, I would say if depending on where it's at, the size of the actual tear and the direction that it goes, it's going to have the ability. So you're going to just have to start moving it. I wouldn't necessarily even recommend ice because you want that area to swell up to get new blood, get the immune system in and start to actually clean out the debris. Where it starts to get kind of tough is once it goes in the inner 2/3, there's not a good blood supply into that area. So a lot of times if you do in fact tear it, it can cause a lot of scar tissue formation. And it just can take forever to be able to heal. So are there times where I looked at people who had a torn meniscus and I said, okay, I see where the tear is. I can see how long it is. I can see that there's a big old flap that's going to be getting into the joint line. I say, it depends on if they're 60 years of age. I say it might be okay for you to just get it removed because anytime that you remove a meniscus, there's going to be a change in mechanics, which will affect you later on, not in a good way. So it depends on age or also what their goals are as well. So some people, listen, if they're a professional basketball player, they have a torn meniscus, they're not waiting around to have it heal on its own. They need to get paid and get back on the basketball floor. And they're willing to do that, sacrifice that now to get paid, even though there's going to be some kind of long-term consequence. So generally, I don't recommend doing any kind of ice. In fact, the only kind of like icing type that I would recommend would be doing like cryotherapy, in which you go in a cryotherapy tube and you reduce your core temperature. But a lot of that just has to do with the transfer of blood from core to extremity and back to extremity, back to the core. And it just it will help with overall inflammation. So I've done it in the past. It's absolutely fantastic. But again, if you're always finding yourself needing to do that, you got to figure out why, obviously, the body has so much inflammation, why it's so inflamed. All right. So notice lines in my nails recently. What's that a sign of? What I would do is check nutrients absorption. So I would check the gut, check food allergies, and then also make sure there's no underlying cardiovascular condition too. When you see, especially the horizontal ridges, not necessarily the ones going up and down. Everybody has those, but the horizontal ridges. Okay. What you notice that is a lot of times, guys, if you start really changing your lifestyle quite a bit, you will notice that your nails will grow back thicker and will see a horizontal line in there, and it will actually kind of delineate when you started making some of those changes in which mineral absorption and things like that actually got better. Okay. Mila asks, with the new food test that only check IgGs, is this test we recommending for people who have already have down the IgEs and IgEs? So I would say this is, if you've tested before and you didn't have any IgEs, and providing that you're not doing anything to overwhelm the immune system, like, because vaccinating is a big thing that can cause a lot of IgEs. And if you've been tested before, you've seen that you are improving, then I think actually as a follow-up test, just getting the skin prick test would be a lot easier, faster, and cheaper for you to do. The only time that we're not recommending just to do the skin prick test, at least for me, is we're not recommending it for people who, especially kids who we think are having some kind of IgE antibody response to specific foods. So we definitely want to get that as well. Again, guys, if you have had IgEs, positive IgE reactions, one of the things that can actually mean is that there can be some kind of parasitic infection within the large intestine. So some people who they're not having a lot of gastrointestinal issues, we're just doing the skin prick. But for some who are having a lot of issues, we're also recommending the IgEs. Okay. All right. Awesome. Are the recommended daily allowances for vitamins and minerals a good guideline to go by? Christine, great question. I'll actually bring that up so that other people can actually see that. I'm going to say this. No. So just remember this. What RDA means is RDA, when they say recommended daily allowance, it's the minimum amount for you to not have a specific disease. Okay. So, when they say you need 500 milligrams of vitamin C per day, that's just to prevent scurvy. Or you need, now they actually raised it up a little bit. It used to be only 400 IUs of vitamin D. That was just to prevent rickets. So now you can see that they have increased the recommended vitamin D levels to, I think, 600 or 700. But in reality is that that's still woefully inadequate. So yes, you're not going to have rickets. No, you're not going to have scurvy. But just remember this: higher doses of those things will have a higher health impact. Now, does that necessarily mean that you're going to need 5,000 milligrams of vitamin C every single day? Not necessarily. There might be some times where you would in fact need that, especially if you're having some problems with bruising or collagen production, or if you're under high adrenal stress in which the body is robbing vitamin C in order to make specific adrenal hormones, then yes, you're going to need more. But if you're just doing the RDA, that is just to prevent known diseases, but having them in higher amounts also will have a higher health benefit from doing that. Okay. All right, guys. Hope that makes sense for you. I appreciate all the questions. If you found value in this, make sure that you like it. Make sure that you share it. And we love doing these for people. And if you found it enjoyable, make sure you give us a thumbs up, give us some love, spread the word. Is that how we get better, healthier as a nation, is by bringing everyone up to health versus knocking everyone down. All right. So we want to help raise you up. So guys, I appreciate all of the questions that you had again. And we look forward to doing this. If you have any other questions that you want us to answer, maybe for next week, go ahead and leave that in the comments below. And then make sure then that you are subscribed to our page. We'll let you know when we're going to be doing a live again, probably another question and answer the day before. So guys, be well, enjoy the rest of your Tuesday, and we will talk to you guys soon.